Hello, everyone. Today's podcast, The Home Care Companion, is brought to you by Companion Extraordinaire, and I am Dawn Benninghove, your host for today. I have a very distinguished guest with us on the podcast today, Mr. Richard, as he likes to be called, Dick Abbott. And he happens to be a gentleman that I have known for numerous years now. And Mr. Abbott, welcome, sir.
Thank you, ma'am.
Yes, indeed.
I'm glad to be here.
We are excited. I've been on pins and needles getting ready to be on this podcast with you this
imagine.
week. And that is Mr. Abbott for you, always making us laugh. He's a great one-liner, and we love that about him. So, Mr. Abbott, you and I met several years ago when your wife, Julie, became ill. You want to talk a little bit about that, if that's all right?
Well, yes, a little.
Okay.
I think it was around the latter part of 2018, early part of 2019.
Mm-hmm.
And we had her in several so-called caregiver homes. And it was a bad experience. And I remember vividly my daughter and I and my son sitting on a bed. I said, what are we going to do? And we all decided we'll bring her home. Probably the best decision we ever made. Unfortunately, I could not handle it. You know, she was up 4 or 5 times a night and during the day, and I just couldn't handle it. So I got an agency in, and I came to you first, but unfortunately you were not staffed to handle. I needed 24 hours a day, 7 days a week. So I got another. And the minute that she passed, I ditched them and I came straight to you. And with your help, I got long-term care, which I can never thank you enough for. And so that it's been, the caregiver that you provided me been with me for 3 years in June. So it's been about 5 or 6 years that you and I have been associated. It's been a wonderful association.
Well, I appreciate that because one of the things people may not know is what I did get to do for Mrs. Abbott, even though we weren't able to provide for the aid care at that time, is Miss Abbott had a little wound on her sacrum, and I was able to come over and provide some nursing services for that at that time. And so people may not know that we do private nursing care. And that's how I believe you and I really got to know each other. And Miss Abbott was such a joy. She was always what I call the hostess. Even when she couldn't get up to greet me, she was always so cordial. And you tell a beautiful story. I know that she was involved, as you are, at Lewis Skinner Botanical Gardens, and she just seemed to know everyone. She just was such the belle of the ball, wouldn't you say?
Yes, that's a good term. Yes. She had, I think, about 4 years service on me, and I had, at that time, I guess 20. So, yeah. She's the one that got me there.
Mm-hmm. And so wonderful and your yard and garden is a reflection of that because you just have plants that I have no idea what they are. They're absolutely beautiful. And I know that you and your current care providers work in the yard some. And so that's amazing. But one of the things that you and I have been able to do together is that I'm a certified case manager. So when we first started helping you out a little bit, you had a ton of doctors that you were going to, and it just got to be pretty overwhelming and confusing at times, and sort of the right hand didn't know what the left hand was doing. I mean, just doctors, they didn't know that maybe you were on this medicine and then you were taking another medicine, and it was just a very trying time for you to try and sort all that out. Would you agree with that?
You were a blessing.
Aww.
Because you went to the doctors with me. Every doctor but the dentist and those unlikely ones, but anybody that was an IST, cardiologist, everything but a ventriloquist, you went with me.
Yes.
And you asked the questions that I wasn't smart enough to ask of the doctors. Mm-hmm. And they gave you answers that I didn't understand, and you covered that with me at a later time. So I don't know what I'd do without you going with me to the doctors.
Well,
You're right. I'd be lost.
I appreciate that. I do know that one of the things that Companion does, our company does, is we write notes. Whether it's a nurse or whether it's an aide, we write notes during the visit.
Yes.
And we had done that on one of your cardiology visits. We had written down one of your medications and the particular number of milligrams, the amount you were supposed to take. And the doctor actually signed the form that I had that day.
Yes.
And just about 6-8 weeks later, you had to get a refill. And I was helping fill your medication box each week. Yeah. And somehow the doctor got the medication, the amount that you were supposed to receive, got it incorrect on the new order.
And I didn't notice it.
No, and had I not had that form, because we were able to go back,
correct,
we had to sort of prove to the doctor that, hey, this really is what you ordered. And
exactly.
It was, as you and I both say, it was life-saving for you.
Yes, it was. Yes.
So, because that medicine was something that would be toxic to you.
Now, are you going to cover my carousel?
Well, I can. Why don't you talk about it?
I have a carousel, and for those of you that don't know what a carousel is, it's a circular thing that can be programmed, excuse me, to disperse medicines days of the week and hours of the day. And Ms. Bennyhove has spaced them so that there's no interaction there's a space between the 10 o'clock and the 7 o'clock, and the 7 o'clock and the 10 o'clock, so that there's no conflict between the minutes. She's done a wonderful job. And she checks on it and makes sure that every week she comes over or has a nurse come over and checks that carousel for me. It's wonderful.
And it's about the size of a dinner plate, so it's not really huge or intrusive or anything like that, or heavy. You're able to, it alarms you, turn it over and put the medicine in your hand, or you like to put it, I love it, a jar lid, right? You have a little green jar lid.
I got a coffee lid, I put it in.
There you go, a coffee lid, that's right. So, but it works beautifully for you and helps keep you independent, because we're not with you 24 hours a day.
You're not.
No, because you still are independent in your time without us there, and you do a beautiful job. You're in a very good health place right now.
Yes.
You had that TAVR, which for some of you all may not know is a valve inside the heart, and Mr. Abbott had that just about a year and several months ago, right? Mm-hmm. And has been doing beautifully since then. But creating your team, as we call it, all of the doctors and nurses and aides, just has really been helpful to you. You're such a great patient, if you will, because you do your exercises, you take therapy. There's just a lot to coordinate for you. In fact, you have a huge calendar, but you're doing very well. And I know that your team of all of us that are working together with you are so pleased at how well you're doing right now.
Well, they're a wonderful team. Now, I'm 92 and my memory's not all that sharp. And so
it's great.
I have to take medications at 7. Well, my caregiver's not there at 7. So now they bring the caregiver down and put it by a little stand where I have my dinner. And they have the water there, so I can't forget it.
Because when the alarm goes off on the machine, then you're able to pick it right up.
I can't miss it, yeah.
So that works very, very well.
I work on it, but I can't.
Right. So let's also talk about, you really believe in giving back to the community, and we've been a part of that and being able to see that. You've been such a wonderful mentor to be able to show us how, good a citizenship, if you will, should be done. And so one of the things that you did is that a friend of mine who's an instructor at Reynolds Community College reached out and asked us if we had any of our clients who would be willing to do a short video about rehab at home and about how to do therapy at home and how to get better, restorative care as we call it. And you were very gracious, and you allowed me to videotape that with you. And they now use that for their first year nursing students to view and show how we as nurses, as well as aides, should really help and can help someone through that restorative time. But it was very enlightening for you. So let's talk about that a little bit, because you were surprised.
You very graciously played that back for me at a later date. And I thought, my God, who is that old man walking across the floor? And it was me, all bent over. And I never realized before how bent over I was when I walked. And it's helped me greatly. And I do it now. But every now and then I catch myself and I think and I try to straighten up. So.
And you are very, very active. You use your stationary bike that you have at home. Mm-hmm. You garden in your garden.
Yes.
So you don't sit still. There are not many days on your calendar that you're not out in the community. I know that the aides drive. You can drive. You still have your license, but allowing us to drive you to different places just gives everybody that assurance. You don't have to worry about it anymore, and we just get you where you got to go. But you are always busy, and that is so wonderful for someone at age 92 to just be so incredibly active, and we love seeing that, and we love being a part of your life in that way.
Well, I grumbled about the driving up 3 years ago. I fussed at you and I fussed at my son.
Yes.
But I tell you, I have found it's such a blessing. My caregivers go, I have so many doctors, I can't remember where they all are. I really can't. And when they're going to say, where are you going? I say, we're going to see Dr. Kimball. I say, well, where is he? And they go, right. I don't understand how they remember all of these places so it's been a blessing. If I was driving, I'd end up in Charlottesville. So, it's been a blessing.
All right, Mr. Abbott. So I have so enjoyed being able to speak with you on our podcast today. And I have one last question for you. I know how you are when you speak to others in the community about your relationship with Companion Extraordinaire. But if you wouldn't mind telling our listeners, if you could say one thing, what would you say about Companion Extraordinaire?
I would say, and I tell anyone that is thinking about it, that go to Companion Extraordinaire. The people in the office are so friendly and so helpful, and I worry the stuffing out of them, but they're always very pleasant and polite and patient with me. I have the best nurse probably in the country. I was going to say East Coast, but it's the country. I have the best nurse. She takes good care of me. She treats me like I'm one of her own. I think she treats all of her patients. She's a hands-on nurse. She doesn't sit in an office and call and answer phone. She's at your bedside, or she's at your side, or she's at your home if you have a problem. She checks my vitals every day. I text her when I'm able, because I don't text very well, but when I'm able to text, I text her. And I always get an answer back. I never call it, I don't get an answer back. It's just a wonderful outfit, and I recommend it to anybody. And I want to thank her personally for my caregivers. They're the best.
They are.
And I know you picked them out. Thank you.
Yes, sir. Absolutely. Well, I am honored to be your nurse. And we at Companion Extraordinaire truly see you as our family. And I know that you see us as family. And it is an amazing opportunity that we are honored to be able to have in our lives, is have you there as well. So thank you, Mr. Abbott, for joining us today. And we thank you all for being with us. And I know that today you have gained so many tools for your toolbox in working with seniors and working with loved ones. We appreciate you listening today.